Hello, everybody. This is Peter and Sylvia. We are back with another episode of Mental Health Food for Thought. We are both therapists, and we weren't always. We have long careers behind us, and something happened along the way to make us retrain. And Sylvia is a therapist. What is it, Sylvia? You are a
I suppose I'm officially a counsellor,
integrative.
yeah, integrative
Yeah,
counsellor
yeah,
and NLP coach, master
yes.
coach, and loads of
And
other things.
And for my sins, I got a degree in psychology and some coaching qualifications and other bits and bobs. So this is what we never even talk about because what we have learned is taken for granted, our skills taken for granted. It's how we get on with our clients that really matters. And yeah, you can see who we are, what we look like, normal looking people and individuals just like everybody else. You can't, when you walk down the street, spot a psychologist or a therapist in some way. They don't look different.
Mm.
And we talk about this today because it is, yet again, once a year, it is Mental Health Awareness Week. I think it's even Mental Health Awareness Month, but this week it's mostly when it happens everywhere. And we're going to talk about how people talk
Mm.
about mental health. Mental health is wide and broad, and we want to narrow it down today to the language that we use. And when I say we, I mean the lay people and I mean the people within the profession of mental health care and intervention. Because we use different language and we often use it inappropriately or in a way that we completely lose our audience. So, where do we start on this one? Do you want to have a go first?
Wow. Picking up on your point about who we are and the professionals within our profession, I think you and I are human beings. We're human beings first. We may have all the qualifications and have all the jargon and all the knowledge behind us, but we are human beings. And when we talk to our, and again, even the wording, is it clients? Is it patients? Is it callers? The people who come to us for whatever reason, we talk to them as they are a human being. And I think quite often the difference, and this may be quite controversial to some listening to this, I also believe that sometimes people will talk as if I am the psychotherapist, I am the counsellor, I am the psychologist. So immediately there's a difference in someone's approach and this person here. The language then can sometimes fall on deaf ears. And I think, again, it's also adapting to who's in front of us. I have worked with other psychologists and psychotherapists and being aware that some of the language I may use, I know that they will understand. However, if I'm talking to someone else, I will adapt my language so it works for them. And I think that's also where we have an advantage because we talk as human beings. And in this Mental Health Awareness Week, the theme is take action, taking actions for better mental health. And picking up on your point there initially, Peter, I think a lot of it is recognising the language that we use. For example, mental health. Mental health is not depression, anxiety, PTSD, OCD. Mental health, decision making, problem solving, creativity, innovation, managing life's ups and downs. That's a point to start with. But also the language that we use, how we use it, how we deliver it, the tone, the intonation that we use when we're talking. The words we speak say volumes. And if the person on the other side doesn't understand those words that we use, then we will then explain, elucidate, expand, so that there is a match, so they understand. And I think that's really, it's the words are so powerful that we use.
And we as professionals have been trained to use language that you and I didn't invent, but it's been invented over years. We talk about syndromes and and disorders, very sort of big, bombastic terminology that can be quite scary. So I think our job is to break it all down. I never really talk about PTSD, for example. Okay, you had a traumatic experience, now you feel stressed, and your brain can't quite figure out what's going on. That sort of thing. Instead of reeling off the textbook explanations the way they were written in the textbook. And I think it comes with experience. I certainly remember when I first graduated in a different field, translation. I was a very sort of militant linguist. It had to be just so, and I knew all the technical terms of grammar and whatever. I can't remember most of it anymore because I realized nobody else spoke that language.
Mhm.
So, so why I couldn't explain anything to anybody when I was an English teacher because those words just didn't resonate with anybody. So we have to come back down to earth as professionals. But then something else has crept in that I'm really not too keen on, and that is how I think maybe it's a sign of the world we live in that everything is more dramatic. So the terminology that, let's call it, lay people use about each other and themselves is far more dramatic than it needs to be. We're no longer just worried or apprehensive. No, anxious.
Mm.
Everybody we don't like is a narcissist,
Mhm.
completely disregarding all the factors that boxes need to tick to to get to that diagnosis. So labels are being thrown around here, there, and everywhere. Oh, I'm a bit OCD today about my desk. No, you're not. OCD is a life debilitating condition that is really nasty to live with. It's not being house proud, for example, is not OCD. So a lot of terminology are being used inappropriately, is what I'm trying to say.
Mhm. Mhm. I concur with that as well. And also when we joked about before we came on air how people will label something and it's as if it's fact, it's an opinion rather than fact. Someone will cross their arms. Oh, you are at identity level defensive. No, it might simply be I don't know what to do with my arms and I haven't got pockets in my trousers today. But coming from someone who says it as a fact, the other person may believe that that then is true, and it's not sometimes correct. You know, you're sitting there like that, Peter. I might say, oh, Peter looks like this, he looks like that. That may not be completely different to how you are feeling and how you are thinking and how you are today. But what I say, if I am the professional, what I say is true, and that's not always the case. I may interpret, but give it back to you. I sense that you are X or feeling X, Y, Z today, Peter, but you might know actually I'm feeling this.
Mhm.
Then I am better informed because I've explored that with you rather than me believing what I think is true.
Yeah.
And for me, and again, this might be contentious, I believe that is wrong because I then will have a preconceived idea of what's going on for you might be completely different from how you
Mhm.
present
Yeah.
today.
And this explains very well why or how you and I work. It's a conversation. It's
Mm,
it's not a presentation of you do this wrong, this is what, this is this, this is that. It's a conversation between our clients and ourselves. I talk about clients, I don't talk about patients.
mm,
Um, Sometimes too, back in the day, I tried to confuse my mom as best I could by calling them customers because they do come and buy stuff from me. But that was just to be facetious.
mm.
But for me, it's clients, it's human beings.
Yeah.
If there was another term, that would be great, but I do not have patience. I'm not
Mm,
in that clinical environment. We also joked a little bit about the work that you and I do is technically clinical work, but I don't work in a clinic. There are no white tiles on my wall. I have no white coats. Um, it's a conversation about what's going on inside this one, the
yeah.
brain.
Oh, you brought your brain along today then?
I have a brain in my office. Sometimes it's appropriate to show it. Um, Also to explain that no, people are not either right-brained or left-brained.
Mm,
That would mean there would be this half. That
yep.
doesn't work.
Doesn't work with
Yes,
the other side though, does
that
it?
doesn't work. Certain parts in the brain take the lead and then communicate with other parts of the brain. That's how it works.
Mm,
So this is not about neuroscience. It's about human beings, and that's what we are.
mm,
So I think we can do an awful lot for our mental health and well-being by also understanding what does normal for me look like? What does good look like?
mm,
Because good has now become amazing. No, you don't need to feel amazing all the time. You need to understand, we all need to understand what does actually, yeah, I'm okay. I'm fine. Nothing wrong. What does that look like? It probably doesn't look very exciting. It doesn't look big and multicolored and everything else. But we need to have that baseline so we understand when we're dipping below it and when we are ecstatic above it.
mm. Totally agree. And a couple of things that popped up for me there is, being okay. In Mental
Mm,
Health Awareness Week, I think one of my biggest things is for people to recognise when they are okay. So then they're able to identify their signs of change or indicators of change that they're not okay. So then they can take actions, do various things to get them back to being okay. But also picking up on a point, you use the word fine. Sometimes it's become synonymous with it becoming a mask.
mhm,
But sometimes I am fine. I am okay.
mhm,
Once again, it's not to misconstrue someone's language to interpret, oh, fine means they're not really. No, they could be fine. They could be okay. And there's a couple of points as well about the language that we use. So many people will say, oh, give me a break, give me a breather, oh, give me a moment. Listen to the words we are using because they are telling you something. They're telling you what you need. I need a break. Give
mhm.
me 5. Pay attention to the language and the words that we use. And as you say, okay is okay.
It is.
It's okay
And
to be okay, and it's okay to not be okay. But if we are not okay, it's not a case of staying not okay. It's taking action to get us back to being okay again.
and that I think is what we can do for this conversation today is say, well, look at the language you use. Your
Mm,
thoughts come from language, language come from thoughts.
mm,
And if we are dialing everything up to 11 when it doesn't need to be, what do we do when the number is 11?
mm,
We shouldn't ignore things either, but it's about the action we can all take is being realistic about where we are, how we feel, and what that looks like, and then take action to take some action about the root causes that makes us feel bad. So I think on that note, we should invite conversation about, well, do you agree with us or do you not? What's your take on the language we use in mental health?
mm. And also, perhaps reflect on your own
Mm,
okay position. Do you know when you're okay? Do you know when you're not okay? And what do you do to get you back to being okay again? Because it doesn't have to be some huge, dramatic, booking some exotic holiday. It could just be stepping away, going and having a cup of tea,
yeah.
going and
So
sitting in the garden watching the birds, or just resting. Resting does not mean doing nothing. You might be observing, you might be planning, but what do you do to be okay?
have a think about that. Let us know what you come up with, and we are always ready for a chat.
Yeah.
Take care. Thank you. Bye for now.
Bye bye.